Hello, my name is Justin Choi. This is my CATA 439 final lab exam, part 2. Our patient comes in presenting with a right-on-right sacral torsion. The way that we are going to be treating this today is going to be from the classical model of firstly treating the structure, followed by working on the myofascia and the range of motion, and finally ending off with strengthening of the hip and pelvis. Our first step of what we're going to do today is going to be a muscle energy technique to correct the right-on-right sacrum. The reason that we're doing this is because we want to bring the bone and the joint back into a neutral position. So we want to have the sacrum lying in neutral between the two ilium bones. What this is going to do is this is going to help bring everything back to a stabilized position. Since we aren't sure right now whether it's going to be a strength deficit issue or a myofascial or muscle tightness issue, this is always going to be the first step of what we want to do with our patient. So, Val, I'm going to get you to lie on your right side because it is a right-on-right rotation. Because the lumbar spine does the opposite of what the sacrum will do in this case, we want to put them in a right rotation because the lumbar spine will typically be in a left rotation on a right-on-right. So downwards facing the table, both arms are going to be grasping the table for extra stability. What I'm going to be doing is I'm going to be taking full control of her knees. She's going to be in a 90-90 position with her hips and her knees. My left hand is going to be on her SI joint, feeling for gapping. My right hand is going to be on her feet, making sure that the feet are going to be crossed, and that's going to be my lever point of where I'm going to be cranking her down. So I'm just going to move your hips up a little bit more. I'm taking full control from the knees with my cranial leg. Left hand is going to be on the SI joint. Right hand is going to be on her feet, using that as a crank with feet crossed. We're going to find that first barrier of where the SI joint starts the first gap. Once we find that, I'm going to get you to contract upwards against me for 6 seconds submaximally, please. And good, relax. So now from this position here, we're going to let the patient relax for a total of 10 seconds, and then we're going to be pushing the feet farther down towards the ground until we feel that new barrier. So this is going to be repeated 4 times over, or until no more range of motion is gained. Our second step in our rehab program for today is going to be working on joint self-mobilizations of the SI joint. So, Val, what I'm going to get you to do is I'm going to get you to put your medial aspect of your shin on the foam roller with your knees and hip at 90 degrees. Bottom leg is going to be completely straightened out. So, just to give a little bit of a background why we're doing this. In any sacral torsion, it's very easy for the SI joint to get stuck or caught up. So what we want to do here is we just want to relieve that pressure that might be going on in the SI joint by opening up the joint space between the sacrum and the ilium. So this is going to be great for that. It's also a great exercise that the patient could take home as a part of their home exercise program. This is going to be good for patients for decreasing their pain, and in terms of from a anatomical perspective, this is going to be significantly more beneficial now because the sacrum has now been put into a neutral position after the muscle energy technique. It's going to be much easier for the patient to gain more range of motion and actually work through the proper range that the sacrum and the hip are supposed to be moving through. So, what I'm going to get you to do from here, Val, is I'm going to get you to try to roll the foam roller out, and you're going to try to lower your hips down so that they're going to be parallel towards the table. Hold this position at end range for 5 seconds, and now come back up into the initial hip stack position, and we're going to repeat that 12 times over for 3 sets. We're going to do that on both sides because we're not sure which aspect of the sacrum and which SI joint could be the one that right now is in dysfunction. Our third step of our treatment plan for today is going to be a static stretch. So our last step and this step are both going to be good for treating for the range of motion as well as releasing the myofascia within the area. So in this case, what we want to be doing here is it's going to be a figure 4 stretch. So Val, I'm going to get you to come down to a supine position. I'm going to get you to bring one of your ankles up onto the opposite knee. And now from this position here, both your hands are going to come and grab the posterior leg in the popliteal fossa. And that's it, is you're going to bring the leg towards yourself as if you were doing a knee to chest. And now you want you to hold that position for the next 15 seconds. So what we're doing here is we're allowing the muscle to relax within these 15 seconds so that it's eccentrically contracting when it first starts, but it's eventually going to relax and allow for an increased range of motion as you push farther and farther into the range. So you're going to relax for the 15, hold it there, and then you're going to pull it a little bit farther. So we want to hold this for 5 repetitions, 15 seconds each time. So why are we doing this? Well, the piriformis is often tight when we're looking at a sacral torsion, whether it's physiological or non-physiological, but especially for this, because it is typically more of a chronic overuse injury. What we'll usually see is that it's due to an improper movement pattern, and whether this is from the piriformis being tight, which is typically the case, what we want to do is we want to release both piriformis that could be hyperactive in this case. So by bringing our hip up to a 90-degree position in this case, or anything above 60 for that matter, the piriformis is becoming an internal rotator. So by putting ourselves into an externally rotated position with the hip and stretching ourselves, pulling us even more into external rotation, we're really getting a nice stretch of the piriformis as an internal rotator in this case. And also, because we know the piriformis does have anatomical attachments towards the anterior portion of the sacrum, what will typically happen if it's tight is the piriformis can latch onto that anterior portion, and if one is tighter than the other, it could start pulling the sacrum backwards into a rotation in either side. Our final portion of our treatment plan for today is going to be a bird dog for strengthening of the hip and pelvis. So the reason that we're going to be doing this today, it's okay, you can stay here for now, I'll explain afterwards. The reason that we're doing a bird dog today is because we want to not only treat what's going on with the sacrum, but we want to start looking more globally at what's happening above and below the sacrum. So we want to get muscles that are going to be surrounding it, firing and stabilizing as they properly should. So Val, I'm going to get you to go into a 4-point position, please. So a few key things of what we want to do before we actually do the exercise itself is, one, we want to find a pelvic neutral. So Val, I'm just going to get you to go through a few pelvic tilts here. Back and forth, and now come back down and find that middle in between. Good. So you're maintaining this pelvic neutral for the entire exercise. The next thing I want you to do is we're going to work on TVA activation. So I want you to try to push or bring the belly button up into the spine without moving the pelvis here. Excuse me. Now from this position here, we're going to work on opposite limb moving at the same time. Now this is going to be a great exercise for neuromuscular control, but now also from a strengthening aspect, one on the limb that's going to be moving, the lower limb that's moving, we're getting good glute max activation, so that's going to work as a strengthening exercise for the glute max, which typically if we're looking at a right-on-right rotation where the piriformis is doing a lot of the work, now we're letting the glute max do its job properly and take some of the load away from the piriformis. So good work on the moving lower limb for the glute max. On the limb that's not moving, the stance limb, that's going to be a great glute med activation for that. So the glute med is going to act as a stabilizer on that one. Excuse me. But then also looking from a core perspective, we're keeping that neutral pelvis in TVA activation. So this is also going to be great for the core as well. So now we're looking at that higher up on the chain, possibly seeing if it could be a core dysfunction that's leading towards the piriformis being overused. And finally, this is also a great exercise for pelvic dissociation. So being able to move the hip independently from being able to move the pelvis is going to be incredibly important going forward through our exercise protocol. So from this position, Val, what I'd like you to do is you're going to take your opposite leg, opposite arm, you're going to kick one forward and one back at the same time, and I'd like you to hold that position for 5 seconds, please. Good, hold that there, making sure that our pelvis stays neutral towards the ground, and come back down. Excellent. So we're going to want to repeat this exercise on both sides over for a total of 10 times on each side, 3 times over. And as mentioned, we're looking for that 5-second hold when they get out to their end.